The real causes of high blood pressure. High blood pressure occurs when the pressure in your arteries rises because of restricted or stiffened arteries. This can increase the risk of heart attacks, strokes, kidney damage, and eye problems. While blood pressure medications may help, they don't address the underlying causes and often come with long-term side effects. In this article, we'll explore the real causes of high blood pressure and how to tackle them with natural remedies. 1. Dehydration, a hidden cause of high blood pressure. When your body is dehydrated, it struggles to produce enough blood. To compensate, your kidneys release a hormone called angiotensin, which narrows your arteries, forcing your blood to circulate faster to make up for the lower volume. This leads to higher blood pressure and also increases sodium retention in the body. To keep your blood pressure stable, drink at least 2 liters of mineral water daily. Be mindful that caffeine, alcohol, and excessive sweating can dehydrate your body and worsen this effect. 2. Potassium deficiency. The balance between sodium and potassium. While many people are advised to reduce sodium intake to lower blood pressure, a deficiency in potassium can actually be a more significant contributor. Potassium works with sodium to regulate fluid balance in and out of cells. Without enough potassium, your body can retain excess fluid, putting strain on your heart and raising blood pressure. The average person doesn't get enough potassium because we aren't eating enough potassium-rich foods like leafy greens. Bananas are often recommended, but they are not the best source as their high sugar content can deplete potassium levels. Aim to consume potassium-rich foods such as spinach, avocados, and sweet potatoes, and make sure to balance your sodium intake. 3. High cortisol levels. Stress and blood pressure. High levels of the stress hormone cortisol, which is released during emotional stress, lack of sleep, or stimulants like caffeine, can raise blood pressure. Cortisol puts your nervous system into overdrive, increasing alertness and tension. Prolonged high cortisol levels can lead to burnout and trouble sleeping, further elevating blood pressure. To manage cortisol levels naturally, try magnesium glycinate, vitamin B1, vitamin D, or lemon balm tea. Regular walks in nature and improving sleep quality can also help reduce cortisol and bring blood pressure back to normal. 4. A high-carb diet, inflammation and artery damage. A diet high in processed carbohydrates, such as sugars, starches, breads, and vegetable oils, can lead to inflammation and damage to your arteries. The body sends cholesterol, calcium, and fibrin to repair the damage, leading to plaque buildup, which narrows the arteries and raises blood pressure. Switch to a diet of whole, unprocessed foods like meat, fish, eggs, vegetables, nuts, and seeds. These foods help reduce inflammation and support healthy circulation. Good quality cheeses can also support heart health by providing healthy fats like CLA, which protect the arteries. 5. Calcium overload. The dangers of calcium supplements. Taking calcium carbonate supplements, commonly used for bone health, can increase the risk of high blood pressure. Calcium from supplements often does not absorb well into bones and instead accumulates in the arteries, causing them to tighten and raising blood pressure. Studies show that taking just 500 milligrams of calcium carbonate daily can increase the risk of heart attacks by 30% and strokes by 20%. To avoid this, stop taking calcium carbonate supplements and instead get calcium from natural sources like vegetables and high-quality European grass-fed cheeses. Magnesium and vitamin K2 are also important for ensuring that calcium is properly directed into the bones rather than accumulating in the arteries. 6. Visceral fat, belly fat, and blood pressure. Carrying excess fat, particularly around the belly, is a major contributor to high blood pressure. Visceral fat, which surrounds your internal organs, releases inflammatory chemicals known as cytokines. These chemicals damage arteries, making them stiffer and leading to higher blood pressure. To reduce visceral fat, consider intermittent fasting or following a low-carb diet. This can help reduce inflammation and lower blood pressure over time. Other common triggers of high blood pressure: vitamin D deficiency. Low vitamin D levels, which are common as people age, can increase blood pressure. Cigarette and vape chemicals. These substances can constrict blood vessels, raising blood pressure. Sedentary lifestyle. Lack of exercise weakens the heart and raises blood pressure. Sleep apnea. This condition, where breathing is interrupted during sleep, can lower oxygen levels and raise blood pressure. How to lower blood pressure naturally. 1. Boost potassium and magnesium intake. Eating nutrient-rich foods like leafy greens, avocados, eggs, and wild salmon helps relax the muscles around your arteries, naturally lowering blood pressure. A large salad with these ingredients every day is a great place to start. 2. Exercise regularly. Physical activities like walking, hiking, swimming, and cycling strengthen your heart and improve circulation. High-intensity interval training, HIIT, can be especially effective at lowering blood pressure. 3. Stay hydrated. Drink at least 2 liters of mineral water daily to support kidney function and control blood pressure. Herbal teas like lemon balm, hibiscus, or chamomile also have blood pressure lowering effects. 4. Improve your sleep. Quality sleep lowers cortisol levels and helps balance hormones that regulate blood pressure. Consider natural sleep supplements containing magnesium glycinate, lemon balm, and tryptophan to improve sleep quality. 5. Eat a low-carb diet. Avoid refined carbs and processed foods, and instead focus on whole foods rich in healthy fats, such as avocados, fatty fish, and olive oil. These foods reduce inflammation and improve circulation. 6. Get sunlight and vitamin D. Spend time outdoors to boost melatonin and vitamin D levels, both of which help relax the arteries. Vitamin K2 also plays a crucial role in directing calcium to the bones and preventing it from accumulating in the arteries. 7. Switch to better salt. Replace processed table salt with higher quality salts like Celtic or Baja Gold sea salt. These contain potassium and magnesium, which help maintain electrolyte balance and support healthy blood pressure. 8. Consume high-quality protein. Instead of processed or plant-based meats, eat whole cuts of grass-fed beef, wild-caught fish, pasture-raised eggs, and organic poultry. Eggs, in particular, are beneficial for your arteries as they help raise HDL cholesterol, which improves circulation. High blood pressure is a serious condition that can lead